If you experience a popping or snapping sensation in the front of your hip when moving the leg, this can be indicative of what is known as snapping hip syndrome. Now, snapping hip can be intra-articular or extra-articular in nature. Intra-articular meaning coming from inside the joint, whether that's due to labral tears, loose bodies, or even fractures. This tends to be the more problematic source of snapping hip compared to the extra-articular. As the clinical terminology evolved, extra-articular or outside the joint snapping hip became subclassified into external snapping hip syndrome and internal snapping hip syndrome. External snapping hip occurs as the iliotibial band slides from the posterior aspect of the greater trochanter to the anterior aspect. This particular movement of the iliotibial band occurs as the hip moves from an extended to a flexed position, such as in single leg hinging movements. We're going to focus on the more common type of snapping hip, which is the internal snapping hip syndrome. And 5 to 10% of the population will experience this at some point, especially if you're active and have to use the leg through more dynamic motions. And this is very common in gymnasts, ballet dancers, and even runners. Internal snapping hip syndrome most commonly occurs as the iliopsoas tendon snaps over underlying bony prominences such as the iliopectineal eminence or the anterior aspect of the femoral head. This typically happens as the femur moves from flexion to extension, such as in a hanging leg raise or kicking type of motion. The snapping sensation could closely mimic an intra-articular hip pathology since they both originate from the anterior hip region. In approximately 50% of cases of internal snapping hip syndrome, an additional intra-articular hip pathology such as labral tear, femoral acetabular impingement can be identified on imaging. So even though this clunking and clicking is annoying, it might seem more sinister than it actually is because we know from research looking at labral tears and FAI that these conditions happen over a long time. So if you do have a symptomatic snapping hip going on and then you go get imaging done and it also shows labral tearing and FAI, it's easy to just blame the labral tears or the hip deformities that you find there when they could have already been there. And we know there's people without labral tears and FAI that also have snapping hip. Luckily, the majority of patients experience a painless snapping, but this is classified as an overuse syndrome. And there can be pain if there's also an iliopsoas tendinopathy or irritation to the bursa nearby. The iliopsoas bursa is one of the largest synovial bursas in the human body, and it lies underneath the iliopsoas near the iliopectineal eminence. So regardless, the iliopsoas tendon is conspicuously taut in hip extension and is leading to some anatomical congestion within the pelvic and inguinal region. So what makes this tendon so taut in the first place? Quite frankly, the iliopsoas is unable to relax and is experiencing a lot of neuromuscular tone and muscular guarding. In my experience, a healthy musculotendinous unit is able to contract and relax on command. When the hip moves into extension, the psoas and the hip flexors have to lengthen. If the muscle is already very taut and contracted, and it's not soft enough to flow out of the way of the bones, then it's going to snap over those bony prominences, kind of like flicking a guitar string or a rubber band. And over time, this can cause thickening to the tendon and make the problem worse. Luckily, there's a fix, and these problems can significantly resolve over time. First, we need to teach the iliopsoas how to be strong in a lengthened position. Isometrics work really well here and can quickly reduce some neuromuscular guarding. Next, we need to teach other muscles that control and stabilize the pelvis in opposing directions, particularly in a posterior pelvic tilt, to stabilize the pelvis proximally as the leg is moving dynamically through flexion and extension. And lastly, we need to strengthen other pelvic stabilizer muscles through the frontal and transverse planes, such as the glute med and min, so the iliopsoas isn't always working overtime as a pelvic stabilizer, and it can just be used to flex the hip. A commonly cited risk factor for iliopsoas tendon problems and internal snapping hip is weakness of the gluteus medius and minimus muscles, which can cause altered hip mechanics and overuse of the iliopsoas. And though snapping hip syndrome is an open kinetic chain issue, meaning the leg is moving in free space, position of the pelvis and the lack of the ability to control the dropping and hiking of the pelvis in the frontal plane and alter the path of the iliopsoas on the opposite leg as it moves over the femoral head during flexion and extension, pre-positioning the iliopsoas under more length. Okay, now that we understand snapping hip a little bit better, let's get into the best exercises to fix it. This is the foam roller hip flexion isometric. Now, when it comes to classic kneeling hip flexor stretches, like this for instance, it's tough to actually get a good isometric contraction through the hip flexors moving forward into hip flexion. So oftentimes, if I try to contract in this position, it's the foot pressing into the ground, so it gets a good contraction through the knee extensors, the quads, but not a very concise contraction through hip flexion. So this drill is going to be very effective for reducing some neuromuscular tone through the hip flexor muscles. So to set up, we're going to use a foam roller. We're going to place it against any sort of pillar, or in this case a squat rack. I have some cushion under the knee. And I'm going to get very close to the pillar here, and I'm going to wrap my fingers around. So I'm going to posteriorly tilt my pelvis as much as I can, which is a relative hip extension. And I do want to set up in some degree of hip extension. So to start, I want my knee directly under the hip, full posterior pelvic tilt. Now I'm going to initiate a contraction of the knee into the foam roller, which is hip flexion, while simultaneously pulling back on this squat rack. So we get this counter pressure through the abdominals while we're also squeezing through the hip flexors here. So I'm just going to hold this isometric for around 30 to 45 seconds, continuously trying to posteriorly tilt the pelvis even more throughout the duration. I should feel my abdominals working pretty hard as well. Again, continuously trying to posterior pelvic tilt more throughout the duration of this isometric, which brings me into more hip extension. Push, 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 push. Okay, so around 30 to 60 second isometric holds is a great place to start there. As a progression, we can elevate the non-working foot on a yoga block, which drops the pelvis on this side, and it brings the hip flexors into more length. And it pre-positions the pelvis in a bit of posterior tilt as well. You can even lift the foot up so you can tension that rectus femoris a bit more, get a bit more co-contraction of the glutes and hamstrings here. But the idea is we're just creating a nice strong isometric through hip flexion. And then when you're done with this drill, you can even retest that kneeling hip flexor stretch that you just did, or what people most commonly do, and you'll notice that there's much less resistance through the hip flexors on the front of this back hip. So give it a try. This next drill is the kettlebell wall-referenced hip flexion drill. Extremely important for not only lengthening and loading the hip flexors in a stretched position, but also educating some of the pelvic stabilizers that oppose the motions of the hip flexors to stabilize the pelvis as that femur moves through flexion and extension dynamically. Oftentimes with snapping hip syndrome, we see that snapping happen with that dynamic motion of the hip flexors. And if the pelvis isn't stable as that leg is moving, then this changes how that iliopsoas has to move over top of the bony prominences in the pelvis. So naturally, when the femur wants to move through extension, see how the lumbar spine wants to move along with that into extension as well. So we need to educate the abdominals to maintain that posterior pelvic tilt as that femur moves dynamically through flexion and extension. And oftentimes this really does clear up some symptoms of snapping. We're going to take a light kettlebell, loop it around the toes. I'm going to have my top leg in around a 90-degree knee angle, pressing into the wall, okay? So we should feel the hamstrings and glutes kick on here. These muscles also help posterior tilt the pelvis, okay? So I'm going to initiate that posterior tilt, dragging the heel down on the wall as I'm pushing my inner sole of the foot into the wall. We also want to make sure the pelvis isn't rotating away toward the camera. I want to keep that pelvis square. Okay, then I'm going to bring that knee up with the kettlebell. Okay, and then as I go down, I'm thinking about pulling my knee toward the wall. Keep the knee pulled toward the wall as I pulse up and down. I mentioned that a healthy muscle should be able to contract and relax relatively quickly. So I like to do this exercise in kind of an end range pulse style, where I'm not going fully up through hip flexion, fully up through extension. I like to stay in that end range position and just kind of pulse up and down, contracting, eccentrically loading the hip flexor, and just staying in that end range. So we could do around 15 to 20 pulses and then hold that last rep, really squeezing the abs, really squeezing the glutes and hamstrings on the wall here. Okay, this drill is what I like to call the end range glute bridge. It's going to educate the glute max to extend the hip from its most shortened position. Now, a lot of times when we do glute bridges, we go from a mid-range position all the way to the top, and people tend to cheat out on that little bit of terminal hip extension at the top. And oftentimes, if the glute isn't strong there in that terminal hip extension, they're just going to use their low back to kind of thrust the entire pelvis forward instead of just moving through the femur. We're going to put a foam roller under the low back, which pre-positions the femur in hip extension. Now, we'll pull this knee to chest, which drags the pelvis posteriorly, which we know is hip extension as well. Extend the knee, and if you do have tight hamstrings, this is even better because that's going to pull the pelvis under even more. And now we're going to initiate the contraction by first pulling the heel toward the sky. So notice as I push, it's a very subtle motion. As I push the foot toward the sky, this turns the pelvis toward this working side leg. This side of the pelvis is below this side. I pull, and that forces the pelvis to stay square, okay? So it puts more lengthening demand on the hip flexors and more of a contraction, a contractile demand on the glute max. Just that shift alone, you might already start to feel the glute max working. So pull the foot toward the sky and then lift the butt off the roller. Hold, 3, 2, 1, back down, reset, shift the pelvis, pull the heel to the sky, lift off. 3, 2, 1. You should feel that glute really contracting hard here. 3, 2, 1. If you thought glute bridges did nothing before, you'll probably change your mind after trying this drill. Important that we get that solid hold at the top and we feel the abs co-contracting here to make sure the lumbar spine isn't deviating into extension. Whew. This last drill is the side plank with horizontal hip abduction. The side plank has been shown time and time again in research to be extremely high with EMG activity for the glute medius and minimus. So like I said, we want to strengthen these muscles, which is going to help offload the iliopsoas in closed and open kinetic chain movement. So we're going to set up in a side plank. And if you know me, I like to load most muscles at end range so we can also get some mobility benefits. So in this case, we're loading the glute medius and minimus in the frontal and transverse plane. So this is going to help improve some hip internal and external rotation as well. I want to categorize this into two groups. If you're on the stiffer type, I want you to do more of a yielding isometric here. So maybe you're really limited in your hip extension, you're really limited in your hip internal and external rotation. Just treat this as an end range isometric. So we're going to set up side plank, but we're going to have the knees directly across from the hips. Okay, I'm going to lift my hips off the ground. Now from here, I'm going to drop the hip so it's toward the ground, but it's just hovering, okay? We're not resting on the ground, we're not holding it all the way up, it's just hovering off the ground, okay? So we're at this end range here. And now to lengthen the glute med and min even more through horizontal adduction, I'm going to drive this knee over top of this bottom knee and then hover this hip from the ground and just hold this isometrically. I can even raise this leg to place more demand in this bottom leg. And you should feel that lateral hip on this downside screaming at you. And then the more you move your butt toward the foot into hip flexion, the harder it gets. Okay, so if I show you from this angle, you'll see this knee goes ahead of the bottom knee, and then we raise it, hover it, butt goes back toward the heel, and I'm holding this for 30 to 45 seconds. If you can manage that, I'm set up by my kettlebells for a reason. We're going to place a weight on that top hip. And this is a really nice loaded stretch, but also a really good strengthening exercise for that glute med and min. Now, if you have a lot of range of motion, but you know you're significantly weaker in the glute med and min, and you feel a lot of neuromuscular guarding in those hip flexors, I want you to take this drill and go through full range of motion. So, how that's going to look, still the same start position. You're going to start from the top, go all the way down, hover this leg, come all the way up into hip extension. You can even abduct this hip as well. Okay, again, the more we sit the hip back into flexion, the harder it is at that lengthened position. So give me a good 2-second hold at the top, 2-second hold at the bottom. And work up to about 15 body weight reps. This is a very challenging exercise, much harder than it looks, so give it a try. And once these glute meds and min get strong at end range, you'll not only notice improved hip rotation, but also reduced neuromuscular tone in the hip flexors, which means over time less snapping. Okay guys, that's the video. If you struggle with snapping hip syndrome and you give these exercises a try, please let me know in the comments how they worked for you. As we know, conditions such as snapping hip are very multifactorial in nature. I dealt with snapping hip syndrome, especially on my left hip, for years. And this was actually my more mobile hip compared to my right. So this just goes to show you that mobility isn't everything. But people do experience snapping hip in their more restricted hip as well. This is why we need to look at the full picture of what's going on within your own individual body. Now, if you consider yourself a very strong and stable person, but hip mobility restrictions are your main vice, then I highly suggest you check out my Supple Hips program. It's going to have all your bases covered for every single range of motion that the hip goes through. And we do have a day dedicated to hip extension. So the drills we went over in this video are going to significantly help reduce that neuromuscular guarding on the hip flexors. But if we do want to improve that end range flexibility and improve hip extension and extensibility of the iliopsoas, then we do have to perform some stretching, some loaded progressive stretching in that end range. We also want to look at the ability for the femur to rotate internally and externally. We have days dedicated to internal and external rotation in the Supple Hips program as well. Till next time, stay supple.